In a double-blind crossover study, okay, just kidding. That's me being a smart aleck. What I really want to talk about today is the real, science-backed difference between facial bloat and abdominal bloat. These are two very different phenomena that often get lumped together, but they're driven by completely separate processes in the body. I get countless messages like, "My face is puffy and my stomach is bloated. What's going on?" It's important to understand that while both may feel similar, the root causes are totally different, which means the way you address them has to be different too. Let's start with facial bloating. Ever woken up and stared in the mirror thinking, "Why do I look like I slept on my face all night?" That puffy, moon face look is incredibly common. And no, you're not being vain for noticing. It's your body sending you a signal. Most facial bloat stems from early-stage dehydration. During sleep, your body naturally loses fluids through respiration and perspiration. Meanwhile, lying down affects fluid distribution, causing water and blood to shift toward the upper part of the body, especially the face. So, in the morning, you're more likely to notice puffiness around your eyes and cheeks. The science? When your body senses dehydration, your kidneys and brain communicate to hold on to water. This leads to water retention, and the face is one of the first areas to show it. Ironically, this puffiness disappears as dehydration worsens, so if your face looks normal again, you might be even more dehydrated than before. But dehydration isn't the only culprit. A lack of mineral balance, particularly too much unopposed sodium, also contributes. Sodium on its own is osmotic. It draws water into tissues. If you're not getting enough potassium or magnesium, sodium remains unopposed, which worsens water retention. This is especially common with processed foods, which are packed with iodized salt and stripped of other electrolytes. How to reduce facial bloat? Hydrate consistently, especially first thing in the morning. Add a pinch of quality salt to your water to improve absorption. Balance sodium intake with potassium. Cream of tartar, a winemaking byproduct, is a great source. 1 teaspoon gives you 475 mg of potassium. Add it to water and drink when puffiness appears. Switch to mineral-rich salts like pink Himalayan, truffle, or unprocessed sea salt, though be cautious with sea salts due to microplastic concerns. Elevate your head slightly during sleep to minimize fluid accumulation in the face overnight. Now, let's switch gears to abdominal bloating. This is a totally different beast. Rather than fluid retention, this kind of bloat is usually digestive, think gas, fermentation, and pressure in the gut. It's often the result of eating foods your body struggles to break down, leading to fermentation in the colon. The biggest offenders? FODMAPs, fermentable oligosaccharides, disaccharides, monosaccharides, and polyols. These are types of carbs that your digestive system doesn't fully absorb. Instead, they travel to your colon where bacteria feed on them, producing gas like hydrogen and methane. The result? Pressure, distension, and a stomach that feels and looks way bigger than it should. One major source of bloating is cruciferous vegetables like broccoli, cabbage, and Brussels sprouts. While they're nutrient-dense, they contain raffinose, a sugar we lack the enzyme to digest. The result? Gas buildup as bacteria fermented in your colon. You get gassy, uncomfortable, and bloated. How to reduce stomach bloat? Avoid raw cruciferous veggies if you're sensitive. Steam them lightly to reduce fiber roughness. Ferment your veggies. This breaks down raffinose and makes digestion easier. Here's a quick method. In a clean jar, combine 1/2 gallon of water with 3 to 6 tablespoons of pink salt and 2 tablespoons of apple cider vinegar. Add chopped broccoli or cabbage. Use a weight to keep the veggies submerged and let ferment at room temp for 24 to 48 hours. The result? Probiotic-rich, pre-digested veggies that are easier on your gut. Consider digestive enzymes, especially those that help break down carbohydrates and fibers. Supplements with alpha-galactosidase can help with raffinose specifically. Slow down when eating. Chewing thoroughly allows enzymes to mix with food and begin digestion early. Remember, Facial bloat equals fluid and minerals, while abdominal bloat equals digestion and fermentation. Each one needs a specific approach, and treating them the same way won't work. Also, in case you're wondering, no animals were harmed in this study. Just a lot of kombucha, broccoli, and self-experimentation. Now that we've gone over the immediate triggers, let's talk about long-term strategies to keep both facial and abdominal bloating in check, not just quick fixes. Long-term fixes for facial bloat. Sleep position. Elevating your head slightly at night with an extra pillow or a wedge helps reduce fluid accumulation in your face. Try to avoid sleeping flat or on your stomach if facial bloat is a recurring issue. Regulate alcohol intake. Alcohol is a diuretic, meaning it dehydrates you while also depleting your electrolytes. If you do drink, offset it with mineral-rich hydration and potassium-rich snacks like avocado or coconut water. Anti-inflammatory foods. Chronic low-grade inflammation can exacerbate puffiness. Including turmeric, omega-3 rich foods like salmon, flaxseed, and berries can reduce inflammation and improve your overall fluid balance. Facial lymphatic drainage. Techniques like gua sha, jade rolling, or even a quick lymphatic massage in the morning can help. These techniques help manually move fluid buildup away from your face and into lymph nodes for elimination. It's not just a spa trend. There's science behind it. Monitor medications. Some common medications can lead to water retention in the face. If you notice consistent facial puffiness, review your medications with a healthcare provider to see if they're contributing. Long-term fixes for abdominal bloat. Improve gut microbiome diversity. A strong, balanced gut microbiome is essential for digesting foods efficiently. Consider incorporating fermented foods along with prebiotic fibers to support healthy gut flora. Elimination diet. If you're dealing with chronic bloating, it might be time to temporarily eliminate high FODMAP foods and then reintroduce them one at a time. This helps pinpoint specific triggers without giving up entire food groups forever. Chew your food. It sounds simple, but most people chew far less than they should. Chewing thoroughly allows enzymes like amylase in your saliva to start breaking down carbs early, giving your gut a head start and reducing fermentation. Stay active. Physical movement helps stimulate digestion. Even a 10-minute post-meal walk can reduce bloating and improve digestion over time. Manage stress. Chronic stress activates the sympathetic nervous system, which slows digestion. That can lead to bloating and discomfort. Incorporating mindfulness, deep breathing, or even short meditation sessions can activate your parasympathetic nervous system. Hydration timing matters. Drinking too much water with meals can dilute stomach acid and slow digestion, which can lead to bloating. Instead, sip during meals and focus on hydrating between them. Hidden causes of persistent bloating. Food intolerances. Beyond lactose and gluten, people may be intolerant to eggs, soy, or even histamine-rich foods. These sensitivities can cause immune responses that trigger bloating and inflammation. SIBO, small intestinal bacterial overgrowth. This is when bacteria that are normally in your colon overgrow in the small intestine. SIBO ferments food too early and creates excessive gas. It often mimics FODMAP intolerance, but may need more medical treatment. Low stomach acid, hypochlorhydria. Surprisingly, too little stomach acid can mimic symptoms of bloating. This can lead to poor breakdown of proteins and carbs, which then ferment lower in the digestive tract. Slow gut motility. This can be due to poor thyroid function, diabetes, or even lack of dietary fiber. When your gut moves too slowly, food ferments longer than it should, causing gas and bloating. Everyday habits that secretly contribute to bloating. Sometimes it's not just what you eat, but how you eat that matters just as much. Eating too quickly. If you're scarfing down meals in 5 minutes or less, you're likely swallowing a ton of air. That air gets trapped in your stomach, creating pressure and bloating. Try pacing your meals to last at least 15 to 20 minutes. Chewing gum or using straws. Both of these introduce extra air into your digestive tract. If you notice bloating frequently and you're a chronic gum chewer or straw user, try ditching them for a week and see what happens. Carbonated beverages, even zero-calorie sodas or sparkling waters, can trigger bloating. They might feel refreshing, but they expand your stomach like a balloon. Overusing protein powders or shakes, especially whey protein concentrates. Many of these contain lactose and artificial sweeteners that don't sit well with sensitive guts. Consider switching to a plant-based or isolate form if you experience bloating post-shake. Common myths about bloating. Debunked, let's bust a few myths that continue to confuse people. Bloating is always from overeating. False. You can eat a small, healthy meal and still bloat if your digestive enzymes are off, if you're stressed, or if you've consumed a trigger food. Cutting salt will fix all bloat. Not entirely true. It's not just about reducing sodium. It's about balancing sodium with potassium and magnesium. The goal is balance, not elimination. Bloating means you're gaining fat. Not at all. Bloating is a temporary expansion, not fat accumulation. It's often just water, air, or gas retention, and it can fluctuate wildly even within a few hours. Drinking more water will make me more bloated. Actually, the opposite is usually true. Proper hydration helps flush out excess sodium, improves digestion, and keeps everything moving through your system. It's dehydration that leads to water retention and bloating. Tools to help you track and manage bloating. If you're serious about solving chronic bloating, consider using some modern tools. Food and symptom journals. Track what you eat, how much, when you eat it, and how you feel afterward. Patterns will emerge, especially with FODMAPs or sugar alcohols. Digestive enzyme supplements. These can be helpful before meals, especially if you're eating something high in fat, fiber, or protein. Look for enzymes like amylase, lipase, lactase, and protease. Stool testing or breath testing for SIBO. If bloating is extreme or doesn't respond to basic changes, get tested. A practitioner can help determine if deeper gut issues are at play. The mind-body connection, let's not forget, your digestive system is directly connected to your nervous system. The gut is often called the second brain for a reason. When you're under constant stress, your body shifts blood flow away from digestion and into fight or flight mode. That means food isn't broken down properly, enzymes don't get secreted, and bacteria have more time to ferment what's left behind. That's a surefire bloating trigger. So even if you're eating perfectly, stress can sabotage your gut. Try incorporating breath work before meals, 5 to 10 deep belly breaths, a short gratitude practice to calm your nervous system. Gentle yoga poses like twists, which help with gas movement. Sneaky foods that trigger bloating, even the healthy ones. Sometimes the foods we think are healthy are the exact ones making us feel bloated. Here are some common culprits to keep an eye on. Lentils and beans. While they're full of fiber and protein, they also contain oligosaccharides, a FODMAP, that are tough to digest. Soaking them overnight or pressure cooking can reduce their bloating effects. Onions and garlic, two of the biggest FODMAP offenders. Raw onion is especially problematic. If you love the flavor, opt for infused oils instead. They give the taste without the bloat. Dairy products. Even if you're not lactose intolerant, dairy can be tough on the gut lining and enzyme levels as we age. Try cutting it out for 1 to 2 weeks to assess your response. Apples and watermelons, surprising, right? These are high in fructose, which many people poorly absorb. If you bloat after eating fruit, fructose malabsorption could be a factor. Hydration hacks to prevent facial and abdominal bloat. We know hydration is key, but how you hydrate matters. Don't chug water all at once. Sipping slowly throughout the day is far more effective than slamming a liter in one go. This can dilute digestive enzymes and cause temporary bloating. Add electrolytes, especially in the morning. Start your day with a glass of water mixed with a pinch of Himalayan salt and a splash of lemon. This simple combo helps jumpstart hydration and mineral balance. Avoid drinking large amounts during meals. Small sips are fine, But excessive fluids with food can dilute stomach acid and impair digestion, leading to, you guessed it, bloating. Natural remedies that help reduce bloating fast. If you're feeling bloated and need relief quickly, try one of these. Peppermint tea, a natural antispasmodic. It relaxes the muscles in your GI tract and can help release trapped gas. Fennel seeds, chew a teaspoon after meals to help with digestion and bloating. Fennel also helps reduce intestinal cramping. Ginger, known for its anti-inflammatory and prodigestive effects. Add it to tea or chew a small piece of raw ginger before meals. Activated charcoal. In some cases, it can bind gas-causing compounds in the gut. Just don't use it too often, and always check with a healthcare provider before using it alongside medications. When to take bloating seriously? Most of the time, bloating is harmless, but there are times when it may signal something deeper. If you're experiencing persistent bloating with other symptoms like unintentional weight loss, chronic fatigue, changes in stool, especially blood, or intense pain, consult a healthcare professional. These could indicate conditions like SIBO, small intestinal bacterial overgrowth, IBS, irritable bowel syndrome, celiac disease, food intolerances, or sensitivities.